Hello everybody, welcome to another video on 668. So today I'll be talking about another scenario that I've encountered during this clinical rotation. So a scenario that's we had a 68 years old lady that came into the clinic. She came in because she had this delusion. So she had a fixed belief that something was crawling under her skin. She believed that some insects were actually crawling under her skin, burrowing her skin, crawling, giving her some scratches. When we asked her if she can see this insect, she said no, but she can feel them crawl under her skin. However, so like I haven't actually I've read about delusional parasitosis, but I haven't seen like it in the real life. I've seen other kinds of beliefs, other kinds of delusion, but this one I haven't seen. So talking about the impact on Cygnus MP. So at this time, this is someone's belief. This is what somebody believes, and the person is actually delusional about it. So at this point, for me as a Cygnus MP student, what we did on that day was to validate her feelings, because we told her, yes, we accept that you're feeling insect crawl under your skin. We accept the fact, like, we acknowledge the fact that you're feeling some burrows, some crawls. However, these things are not real. They are not real. They are delusional. So, as a Cygnus MP, it's very important. As a future Cygnus MP, it's very important for you to like validate patient's patient experience, whatever the patient is telling you. Yeah, that's okay. At that point, we don't need to judge them. We don't need to tell them they are not real, because they are the ones that are feeling these things. They are the ones that feel like they are experiencing that thing. But it's okay to tell them that they are not real. So that was what we did at that point. So talking about the psychopathological insight. So at this point, I've read about somatic delusion. That's when people experience like things that are not real, feeling of things that are not real. I've read it in the books. I've been taught about it, but I haven't like seen it in the real life. So at that point, I was able to appreciate what I've read. I was able to put my knowledge into practice, and also because at that point I was faced with the challenge of solving that problem. So I would say that's the psychological impact of that scenario. So talking about my strengths and limitation, so I very active listening was the very important strengths I have, which I utilized during this situation, because I really had to pay very much attention, listen more than I speak to this patient, because it's a very difficult situation when somebody tells you things that are not like they are not existing, things that are not real. So I was really like I used active listening skill, because and also doing I also used interviewing to know if what she would have done, what did she do when she experienced such thing. That way I can be able to assess this patient. I can be able to know the patient's intention, because some people could start cutting themselves to say that they want to kill the insect. So at that point, I use active listening. I use therapeutic interviewing to really figure out the patient, what the patient can do whenever he or she is feeling that. Also, I was not judgmental, because it's not good to judge, especially psych patients. That way they'll be able to trust you. They'll be able to feel comfortable to open up, to tell you more information about themselves. So talking about my limitations, I would say at that point there was no solution, because patient was expecting that, hey, probably there should be a medication that could stop that, or probably kill the insects. But obviously, the point that I wasn't able to like give a solution to this patient, like basically maybe pharmacological, or any kind of solution for this patient. Rather, what we did was to focus on anxiety. Probably this thing, anxiety, could trigger the delusion. We focused on sleep hygiene. We focused on like diversional therapies, like a kind of trying to divert patient. We educated the patient on like diverting diverting her attention whenever she feels that the insect is crawling. Also, we also talked about therapy, so that someone could talk to her that these things are not real. We got to focus our mind away from this thing, because they do not exist. It's what you feel that it is, but however, it is not real. So, talking about therapeutic use of self. So, at all times, I remain non judgmental. I validate patient feelings, because their feelings are really valid. Whatever they're telling you are valid. They might not be real, but we have to like acknowledge, I accept you feel this way. I accept that these things are the things you're experiencing. So I would say these are the therapeutic things that I use therapeutically to ensure that conversation goes well. Talking about application for future practice. So in future, I will make sure that I continue to use active listening whenever I'm seeing patients. I try to validate their feelings. I try to validate their feelings at all times. So, like, kind of validating their feelings helps to provide trust, which forms like the foundation for a treatment plan, or the foundation for a conversation to hold. Also, in future, I acknowledge the fact that there could be sometimes when there would not be like a therapy, like a pharmacological plan or a solution for a patient. Then we have to divert to probably symptom relief, just like in this situation, like anxiety, sleep, and etc. Thank you very much.